This video provides general information about dental implant surgery, including some of the risks, benefits, and alternatives to surgery. We are providing this information to assist in your decision whether or not to proceed with this surgery. Please note that not all of this information applies to every patient. For specific information about your diagnosis, treatment options, surgery, and recovery, be sure to ask your oral and maxillofacial surgeon. This video will cover what a dental implant is, how to prepare for your surgery, risks associated with dental implants, pain management options, and what to expect following surgery, including at-home care. Dental implants are a replacement for a missing tooth or teeth. Dental implants can also be used to provide support for a fixed bridge or dentures. Dental implant surgery is a team effort that includes you as the patient, your surgeon, and your restorative dentist all working together to design a treatment plan that meets your needs. Implant placement can be completed in a single appointment or in phases over time, depending on the treatment plan. Typically, the surgeon will place the implant and the temporary healing abutment. Then, the restorative dentist will place the permanent abutment and complete the final restoration. Depending on your treatment plan, restorative options may include a single implant and crown to replace a missing tooth, one or more implants and a fixed bridge to replace multiple teeth, or two or more implants and a denture to replace many teeth. While some implants can be restored immediately, others may require additional time for implant integration or fusing to the bone before a final restoration can be placed. Before surgery, or sometimes during surgery, your surgeon may discover that the quality or quantity of your bone may not support the implant. In these cases, a bone graft at the implant site may be recommended. There are several options for obtaining bone for bone grafting, including bone from a tissue bank or bone from your own body. This may result in a change to the planned restoration. Your surgeon will discuss these options with you. If bone grafting is required, your surgeon will discuss whether the graft will be performed as a separate procedure prior to implant placement and require a period of healing, or if bone grafting can be completed at the same time as implant placement. Your care team will provide you with specific instructions to help you prepare for surgery. A few common instructions include if you should take your regularly prescribed medications, the time to arrive for surgery, how long your surgery will take, and your discharge plans. Depending on the type of anesthesia you and your surgeon have decided on, you may be instructed not to eat or drink for at least 6 hours prior to surgery. Each patient's treatment plan is unique, so be sure to ask your care team about how to prepare for your surgery. While all surgery carries risk, your surgeon will try to prevent, minimize, and control these risks. Nonetheless, it is important for you to understand these risks before your surgery. Your surgeon cannot guarantee the results of the procedure, and the length of time needed to complete treatment may vary for each patient. With dental implant surgery, you may experience pain, swelling, bleeding, temporary bruising, soreness or cracking at the corners of the mouth, tissue scarring, damage to your lips, jaw, and teeth, including existing dental work, stress or damage to the jaw joint, or in rare cases, a jaw fracture. Infection can happen with any surgery and is often treated with antibiotics. However, some infections may require prolonged treatment, additional surgeries, or in rare cases, hospitalization. There are several nerves in your face, including those in your upper and lower jaws. Dental implant surgery, or the use of local anesthesia, can cause injury to these nerves. These nerve injuries can result in altered or loss of sensation, including loss of taste or numbness. Nerve injuries can also cause pain or altered feeling in the face, cheeks, lips, chin, teeth, gums, and/or tongue. Nerve changes after surgery may resolve over time, but in some cases, the changes may be permanent. Additional risks with implant surgery include an opening from the mouth into the nasal or sinus cavities with possible implant displacement, irreversible bone reduction at the site of the implant, bone loss around the implant, implant loosening or failure, and/or failure of the abutment, screws, or restoration. Some of these complications may require additional surgery, removal of the implant, or restoring your teeth with options other than implants. Implant failure can occur when the implant fails to integrate or fuse with the bone, resulting in loosening, pain, and/or bleeding. Implant integration can be affected by several factors, including trauma from either temporary replacement teeth or excessive loading or chewing, your bone density, certain medications you may be taking, or certain medical conditions, including diabetes. Hard, sticky, or chewy foods may impact successful implant integration. Your surgeon may alter your diet to limit these foods while the implant integrates. Continuing to smoke or vape and otherwise not following your surgeon's instructions may also cause the implant to fail. Poor oral hygiene can also affect implant integration. For long-term success, you need to care for dental implants with the same routine care as your natural teeth. This includes brushing, flossing, and regular cleanings. If not well cared for, your gums around the implant may become infected, which can lead to discomfort, infection, bone loss, and the eventual loss of the implant. It is important that you understand your responsibilities related to long-term maintenance of your dental implant. The treatments for implant failure vary based on the cause and severity of the failure. Some patients may require more frequent cleanings, education on improving dental hygiene, or antibiotics. Others may require additional surgery, bone grafting, or implant replacement. Your surgeon will discuss with you the available options to control your pain and anxiety during and after surgery. During surgery, local anesthesia is used to numb the surgical site. The numbness from local anesthesia can last for a few hours after surgery and allows most patients the time needed to get home and start taking their pain medication before the numbness wears off. In addition to local anesthesia, you may be a candidate for other anesthesia options. IV sedation or general anesthesia may cause some patients to experience disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in a hospital or an outpatient setting, these risks can be serious and in rare cases may even be fatal. After surgery, many patients effectively control their pain with over-the-counter pain relievers, such as acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil and Motrin. Some patients may require stronger prescription medications like narcotics or opioids to help relieve moderate to severe post-surgical pain. Be sure to discuss your pain control options with your surgeon. For patients that receive IV sedation or general anesthesia, please be aware that these medications can have a different effect on each patient. Some patients may have lingering anesthesia effects, including memory and coordination issues, for an extended time, possibly into the day after surgery. Because your doctor cannot predict how you will react to IV sedation or general anesthesia, an escort must accompany you to the office, remain in the office during surgery, drive you home, and stay with you after surgery until the effects of anesthesia are no longer present. This is typically 4 to 8 hours after discharge from the office. It's important to understand that an escort is a responsible adult who can assist you after surgery until you are sufficiently recovered from the effects of anesthesia. You and your escort will receive instructions for home care and follow-up. Please be aware that if your escort is not available on the day of surgery, the surgery may be delayed, rescheduled, or completed with local anesthesia only. Once home, it is important for you to rest and follow the home care instructions. If you experience more than moderate discomfort, excessive bleeding, or have any post-procedure questions, you or your escort should call your care team for additional consultation and directions. For most patients, their diet for the first few days after surgery consists of soft foods that require little to no chewing. You may receive more specific diet instructions from your surgeon depending upon your specific surgery. This video provided a general understanding about dental implant surgery to assist in your decision whether or not to proceed with treatment. Each patient and their treatment plan are unique. You, your oral surgeon, and your restorative dentist will work together to prepare a treatment plan that meets your needs. Please consult your oral surgeon if you would like further explanation about any information in this video, or if you have questions about your specific treatment plan or topics that may not have been included in this video.